I used to be a general endocrinologist. For 20 some odd years I did general endocrinology, but back in the 1990s I started doing ultrasound work. Ultrasonography improved, and as the processors improved, I realized that that's what I wanted to do with my career, is move toward imaging small endocrine tumors, particularly tumors in the neck. So I started looking very carefully at thyroid tumors and at parathyroid adenomas, which are just enlarged parathyroid glands. As I got better at using the technology, and as the technology improved, I suddenly realized that we had a base for doing a very unique practice, and that is the practice where we integrated minimally invasive endocrine surgery techniques with this fancy imaging that was emerging around the turn of the century. I developed a relationship with Dr. Bimston, and that led to us coming to the Memorial Health System in 2011 and putting together the first integrative endocrine surgery practice, as far as I know, the first one in the country that was done in association with a hospital system. We can bring the imaging techniques, we can do the biopsy techniques, we can bring molecular technologies to the table, we can bring cytology, and then we bring the surgeon into the same room, make the decisions right then and there, and get the patient scheduled for the right surgery.
If one of my endocrinology colleagues determines that the patient has parathyroid disease requiring surgical intervention, then we both interact with the patient at the same time. We have created a patient-centered experience where large flat panel TVs are placed on the ceiling above where the patient is being ultrasounded, and they see where their abnormal parathyroid is. We're in the room with them at the time. Both my endocrinology colleague and myself describe to the patient what they're seeing, explain what our plans are for surgery, and come up with a comprehensive plan for surgical intervention, so that when the patient leaves our office, they not only know that they're having surgery, but they understand the rationale why they're having surgery.
There's less visits involved and less travel for the patient because it can be all accomplished in one location here. The reason I became a memorial physician was because Dr. Harrell was a pioneer in developing the integrative model. We have great depth of experience in that, and we think we have better outcomes with more efficient use of resources.
We chose Memorial because they chose us. And they were interested in our concept of integrative care. And they were also interested in their patients getting the most impactful surgeries that were one and done, surgeries that were done without infection, and surgeries that required less anesthesia and allowed for early discharge. Memorial puts the patient in the center of the care. And that's really, that pretty much sums up what we try to do in this office.